Okay, now we're going to be using our muscle man to go over some more surface anatomy. So we're going to start on the side, and here would be our TMJ, which stands for temporomandibular joint. Remember, that's your jaw joint. This is the facial artery, right under the jawline there. Then we have cervical lymph nodes under the jaw and the neck. We have zygomatic arch. Here's our sternocleidoid mastoid, big neck muscle, easy to see. And it is partially covering this common carotid artery. And now we're up front, we can also see the philtrum in the lip. Remember, the philtrum is where the upper lip was forming, and the philtrum is where it closes. Okay, so now we're going to move down. Okay, so this is our clavicle. So in this area, we would find the subclavian artery and vein. Then we can move down. This is our abdomen. Okay, so this is the edge of the rectus abdominis. That is called the linea semilunaris, just that edge. And where that edge meets the edge of your ribs, that is where your gallbladder is. So your gallbladder is at the intersection of the costal margin, which is the edge of the ribs, and the semilunaris. So right up here, right up on the upper right quadrant, that's gallbladder. Okay, now if we move down, I can see the iliac crest. And if we move over just a little bit, this is the McBurney's point. The McBurney's point is showing appendix. So again, you would palpate, auscultate in this general area if you thought the appendix was the issue. Now, if we go up here, this is our left upper quadrant. This is where the spleen is found. So if we're having issues with spleen, you'll be tender in that area. If we go to the left lower quadrant, this area typically becomes bothersome with people with diverticulitis or diverticulosis. Okay, so now let's move over to our arm. And we have the armpit, which is the axilla. I can see my deltoid, which is an intramuscular injection site. Remember, think flu shot. Then I have my antecubital fossa. Remember, that's the inside of the elbow. That is also where you find the median cubital vein. Then, if we turn just a little bit on the inside, there is a brachial artery, which will come down and split into the radial artery, which we use for pulse. And then on the pinky side would be the ulnar artery. Okay, so now let's move on down into the legs. Okay, so these group of muscles are called the quadriceps. This is the femoral triangle. You want to avoid this area because the femoral artery, femoral vein, and femoral nerve all being close to the surface. Now, the other part of the femoral triangle are these muscles. These are called the adductor muscle group. So you had the quadriceps and then the adductor muscle group. Okay, so now let's go back to the quadriceps. And the quadriceps had four muscles. You had the rectus femoris, vastus medialis, and vastus lateralis. The vastus lateralis is another injection site. So that's an intramuscular injection site, and this is the one that's commonly used in children. Okay, so now if you go all the way down to the bottom by the foot on the inside, you could see the posterior tibial artery. Now we're going to turn our little guy around. Okay, so we're going to start at the bottom. We have our gastrocnemius, that's our calf muscle. Then we come up and we have our hamstrings. This is the gluteus maximus. And then the small one up here is the gluteus medius. This is the last injection site. So the gluteus medius is an IM, intramuscular injection site. Okay, so it's important to understand that this is the gluteus medius that we're saying is an injection site, not the maximus. The maximus is typically covered in fat. Fat does not metabolize medicine, it stores it. We don't want it to be stored. We want it to be metabolized, enter the bloodstream, and go do whatever it's supposed to do. So, you want muscle. Gluteus medius. So here you can see that natal cleft. And then we're going to come up the back and over to the shoulder, and we have the deltoid. Okay, so remember the deltoid was another IM or intramuscular injection site. All right, that concludes this model.